hold your breath. All right, and breathe. And hold your breath. And breathe. Now I'm going to listen to your heart. Just breathe normally. And sometimes if the patient hasn't eaten, you'll get bowel sounds with your heart sound. Going back with my bell.
So we do it with the diaphragm and then with the bell? And then if we have a scope that doesn't have both sides, we just tell you we're pressing harder?
Yeah. All right. If you wouldn't mind lifting your shirt up for me, Mr. Daniel. Thank you.
And that's Herb's Point?
Mm-hmm.
Way up here? I thought it was further down.
Right up in the mid. Mm-hmm. Now I'm going to listen to vowel sounds. Plenty of them. I'm inspecting for peristaltic movements and heaves in the abdomen as well. Remember, you never palpate the abdomen until after you listen. All right, I listen for my rubs over the spleen and liver. Now I'm going to go back with my bell and listen for bruits as well. Spleen, aorta, liver. Now I'm going to go to the femorals. These are the femorals way down in here, so I'm going to save Pete from unbuckling his pants.
They can't see my femoral.
I didn't think femorals were on the
That's a pay site.
assessment.
That's a pay site. We got to do our dollars.
That's right.
Okay, it's in our on our list. Now I'm gonna
Femorals is on
It's
the
not on
list.
our list.
It's not? Okay. Now I'm just gonna lightly palpate, starting in the right lower quad. And I'm gonna tickle him.
Are you doing deep?
No, this is light.
Light?
This is deep.
Okay.
Sorry, Pete.
That's all right.
I should have warned you, huh?
Kids.
I feel like deathly ill.
All right. Then I'm going to the lower extremities and checking out everything as far as the integument system, hair distribution, lesions, nodules, moles, anything abnormal there. And I'm going to go ahead and check pulses. I like to check my pulses all at the 30 degrees. This position of the patient, sometimes if their legs are dependent in the sitting position, they're kind of swollen and it can feel them as well. So if I get them in this position, sometimes with the fluid distribution, they're easier to fill. All intact. Good. Now what I want you to do, since we're just going to check out the hip, the knee, and the ankle, no need to do the toes, I want you to raise your leg. Good. And I want you to bring your leg out. Bring your leg in, crossing over that other leg. Perfect. Now I want to do it against resistance. Resist me pulling up and pulling down, pushing down rather. Resist me pushing in. Resist me pushing, pulling out. Good. This side, up, and come whichever way. That's good. All right, resist me pulling up, resist me pushing down, resist me pushing out, and pulling in. Good. Same thing with the knee. Can you raise the hip up, bend your knee at a 90-degree or more angle, or less? Straighten. Can you bring your hip back to your your ankle back to your bottom as much as you can? Good. And cross your knee over that knee, keeping your hip nice and straight, and out. And this needs to come out. There we go. Good. Now resist me pushing down with your knee, and up with your knee. Good. And in, and out. Good. This side. Straight up. Like this. And back down. Can you bring your ankle as far back to your bottom as you can? Good. Now cross just this foot over this, and then out. Good. Now resist me pushing down, pulling up, out, and in. Good. Now the ankle, can you bring your toes back towards your head, point them towards the other wall, and roll. Good. Kind of push back, push down. Again, push back, push down. Resist me going this way, and this way, and this way. Good. Now I'm going to do a couple of different soft, dull, and sharp items. Tell me which one it is that you feel. If you would, please close your eyes. Tell me if this is sharp, dull, or soft.
Sharp. Dull. Soft. Sharp. Dull. Sharp. 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 Soft. Dull. Dull.
Good. Calf refill.
Would you ever show the patient
open up.
before, like this is the sharp that's going to be a point of
You don't have to.
just to let them know what sharp feels like versus dull?
Sure. I mean, I think one of the videos showed you could do that.
Okay.
Yeah.
Because like on the first one, I wasn't sure
Mm-hmm.
how sharp was going to be.
Mhm. All right. Mr. Daniel, I think I can give you a clean bill of health. Congratulations.
Thank you very much.
All right, what did I miss? Count off my points. What did I? That's part of the subjective. Now, not subjective, but part of the objective.
You didn't hand hygiene when you left.
True. Didn't hand hygiene when I left.
Visual acuity, we don't need to do the newspaper, the close-up one.
It says smelling chart, Rosenbach,
Or
Jaeger,
newspaper.
or yeah. You
pick
choose.
what to read.
You choose.
Did somebody mention mental status already?
Say that again.
Did somebody mention mental status already?
Mental status is under general survey, which you'll
She's
complete
phrasing.
prior.
You did position codes, right?
What are the
What did I miss, y'all? Give me a grade. Add it up. Did you check me off? Probably not.
what are the four?
Did you do
It's,
the Did you check the?
Okay, I might have been looking at my notes. What about the T&J?
Is that part? Is that on the? It is. But I didn't do a TMJ. How much is that all? All right. So I'm at a what? 84.
Yeah.
I'm looking for TMJ, y'all.
It's in her hand. That's last one in her hand.
I did not ask him to
15
open
points
and
for
close.
this.
I felt the joint, but no, I did not assess for precipice, which is the open and close.
Do you want them to move side to side too, or just the open and close?
Just the open and close is fine.
you didn't say crepitus in the
Precipice.
respiratory assessment. I don't know if you have to.
That's what I'm saying, because here it says.
You did go for primitus with the name, but no crepitus.
But when you're palpating,
But that's what I mean. I didn't hear you say it. I mean, I don't know.
I didn't say.
Did you do the
But do your patients always know what primitus means?
I just meant,
ask her, just
Ooh.
Right. But my assumption is that you know what you're doing.
Right.
You've been taught this, and so if you're palpating, you can just tell your patient, I'm going to feel around.
Right.
And that's my, I'm going to feel around for masculine lesion, just look at your skin back that because they make
Right.
sure everything's do like that.
Well,
What
you
else
mean-
I missed?
you-
I can't hear. You guys might have the same question.
Were we doing the inspection on the